Good afternoon. We're here at the San Antonio Breast Cancer Symposium, and we're sitting with Sandi Stanford from the Alamo Breast Cancer Foundation. So Sandi, thank you so much for joining us today.
Thank you, Courtland. My pleasure.
Well, we'd like to first start talking with you about your mission, and we know that part of your mission is to expand knowledge through education and community outreach.
Exactly.
And one thing that we think doesn't really get a lot of focus in education and community outreach is men who are diagnosed with breast cancer. So how is your organization working to educate the public on that?
We always, whenever we do an outreach program, or we do in October, we do breast health awareness programs, we always put up slides that have the number of men every year that develop breast cancer. We explain breast cancer is not just a woman's disease. Men have breast tissue also. Mm-hmm. Anyone who has breast tissue, including animals, can get breast cancer. So we explain that, and we tell them that there are men, and in our group this year, we actually have 2 men who are breast cancer survivors. One, a younger man who has been surviving for, I think, 4 or 5 years. The other one who's a more long-term survivor. And they have the same issues that women have. So it's really important that men know that this is a disease not just of women, but of women and men. Mm-hmm. And that while prostate cancer only men can get, breast cancer both sexes can get, and that it's extremely important for not only the people to have the knowledge, but for physicians to understand that that lump that the man has might just not be for a sore muscle from swinging a golf club or throwing a ball too hard. It could actually be breast cancer. Mm-hmm. So they need, while they don't get mammograms, they do need to do self-exams. The doctors do need to do exams on them when they know, or when a man comes in and says, I've got this muscle that, it's like, it's really sore, or I have this lump, I'm not sure what I did, that the physicians, general practitioners, know about this disease, and men get it also, and that clinical trials include not only women, but men. Mm-hmm. And the data has shown that there is some difference between men with breast cancer and women with breast cancer, but for the majority, the trials, the drugs work exactly the same, so that men should be included in clinical trials, and men should have their own clinical trials. Mm-hmm. So I think there's very few clinical trials that even include men, or that are for men only. So we think it's extremely important to educate not only the public, but oncologists and general practitioners on that information also.